So Carly is a 17-year-old female with Down syndrome, and she also has congenital heart disease. She is currently a senior at Century High School. Carly has had 2 eye surgeries and a heart repair to fix an AV canal defect. She is currently not participating in PT, but she has poor balance, a fear of heights, and low muscle tone. Carly is also somewhat nonverbal. We started the session with manual muscle testing for the lower extremities. However, we were unable to get accurate measurements due to the patient not understanding the directions to hold against resistance. However, the patient was able to perform a full depth squat to pick up a ball. We did the balance and bilateral coordination subsections of the BOT2. Because this is a norm reference test, we were looking at quality of her performance rather than her actual score. We also ran a 6-minute walk test and a functional reach test. We did these to assess her balance and endurance while walking.
Okay, so our main problem areas that we want to focus on is her poor core strength, her single leg balance, and her loss of balance strategies and gait mechanics. And then the main balance problem area that we're going to focus on is her poor balance in single leg stance and tandem stance, which we saw while we were assessing her balance for the BOT2.
All right, so the main issue that we had was having a good standardized test to use with her because of her age and her diagnosis. So our question for instructor is there a better standardized test that we could have used instead of the BOT2 for this assessment? And as far as case-related studies that we want to look at ways to reduce fear of falling in pediatric patients, and we also want to look at the effect of the decreased functional reaching on participation and ADLs.
So for our next session, we plan on working on balance by doing a balloon toss activity. We'll allow her to use 2 feet and hopefully reaching outside of her base of support. Once we get okay there, we'll eventually move to single leg balance or tandem stance. If she has a greater fear of falling, reaching outside of her base of support, we could always use a gait belt to decrease that fear. We're also going to do some gait activities to increase her speed on a flat surface, and then we'll progress that to an unstable surface. And we also plan to potentially use the Wii to do some balance activities and include some fun stuff in our session. Lastly, we'll use a scooter board with a jump rope to work on some more core stability and reciprocal motion as she moves around on the scooter board.